Let me let me start all over again. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to the beginning of this diploma in Hijama cupping therapy, which is being run by Shifa Holistic Healthcare in collaboration with the Hijama and Prophetic Medicine Institute in the UK. This program will be running for 6 months, inshallah, and we'll have a fully online section with all therapies being demonstrated and participants or students practicing them before a live camera and being monitored. And it'll have the second component where we'll have an in-house live training where we will be interacting with the students here in Nigeria. If you have any questions, please do not hesitate to ask as we get along. Like I said, we'll be running for 6 months. We'll have various modules, and I'll take you through the modules now. And while we wait for more participants to join in, we have a class so far of about 11 participants, but we have only 4 of us in the class right now. While we wait, we will continue and we will share the recordings. Each recording will be shared to the students so that you can monitor it and go. There is a need to have a notebook or an exercise book or file or folder or whatever, a jotter, the way you're comfortable in making notes. So you make notes of these lectures in your own understanding and in your own wordings. Lecture materials, which are some books, textbooks and books on hijama, copying and some research papers will be given as we go along with the program, which will form your reading material and your library, inshallah. As we go along, you'll find out that some topics that will come up will not be dealt with in depth because sorry, I'm having some network challenges here, but alhamdulillah, we're back and we'll continue where we stopped, bismillah. So like I was saying, I'm not sure where it went off, but for those in Nigeria, we'll have hands-on practicals that will last about 7 days. For those in the diaspora who are going to be running the program online, we would be supervising everything that you do and will demonstrate and you would follow. The course will have a number of modules, which would I'll be going through right now. There'll be about 6 modules in all. And we intend to go through step by step to give you an understanding of the whole setup of hijama. And inshallah, that in itself would come piecemeal. It'll come as in-depth as we possibly can give it. And along the line, if you have any questions, please ask. Like I was saying before the network went off, I don't know if it picked it on the record. Some topics would not be gone to in-depth because they're for an advanced class. However, they will be looked at so that an understanding will be gotten. Now in module 1, which we will be starting probably on Thursday, would be comprising of definitions of cupping and hijama therapy to look at what the differences will be, going into a history briefly for hijama and types of cups that are used for cupping therapy, an explanation of how hijama works. We will have an end of unit quiz in each unit, and this quiz would be written and sent. It will be marked and assessed too. Module 2 will have guidelines for performing hijama. who should practice hijama, general contradictions and precautions one should take, and who should have hijama done on them. There'll also be a quiz at that end of that unit. Module 3, as we go along, will tell us the benefits of hijama, look at the constitutions of body and body types, an introduction to body anatomy, and an end of unit quiz. Now here, when we're talking of the body, we're not talking of the body in light of Western medicine or anatomy as you know it. We're looking at the body in the spirit and in the light of Unani medicine or the practitioners of hijama as they understood the body when they started practice of hijama. It is that understanding that leads to the success and good benefits and good reports we're having about hijama. So we would look at anatomy, yes, to some extent, as the body is various components, organs, but we'll look at it from the understanding of the hijama, the person who practices hijama, from the understanding of the medical science behind what they're doing. Now, in Module 4, we will have an introduction to diagnosis, introduction to test reports. The idea behind this is you should know how to diagnose your patients, and you should know how to read, to a good extent, test reports they might come with. You find most patients would come in with a test report from one laboratory or the other, or one hospital or the other, telling you they've been diagnosed with whatever it is. You should be able to read it and understand it. But you're supposed to be able to diagnose. So the report actually is just supposed to support and to give more confidence to your patient. So he sees or she sees how she came in, and after your treatment, another test is done and they see the difference, positive, inshallah, and these results help give more confidence in so much as you have the person telling you I'm feeling better, and so much so like that. Now in Module 4 too, we'll be looking at the Sunnah points, Hijama Sunnah points. We'll be looking at the general body points of Hijama, and there will be an end of unit quiz here too. By the time we get to Module 5, inshallah, we'll look at those cups, still the types of cups that are being used, the types of cupping techniques, various types of cupping techniques, water cupping, fire cupping, various ways that that vacuum is created. We'll be looking at that. And then we will start with performing how you perform hijama, practical parts or demonstrations of that. And then we will have an end of unit quiz. Module 6 will take us to an introduction to herbal medicine. Now, hijama in itself is a treatment and a process, a medical procedure. But in most cases, you need to supplement with one herb or the other. Now, we will break this into Islamic medicines and traditional medicines. Islamic medicines will be those that have come with hadith that were practiced by Nabi Sallallahu Alaihi Wasallam, and we've been told they have medicinal values, and science has backed it up now, how to use them in various ailments and like that. Traditional medicines will be more of herbs that are locally used in various places to treat. The idea is to understand how you could use the herb and how you could determine which herb you will use. These two would be brushed on, like a few other things that I will pass through already. They would not go in detail because that would be for an advanced class. They are topics of their own, so to speak, specialties of their own. Then we'll look at treatments. Here at treatments is where we would really have that practical class hands-on, and we will look at various ways to diagnose the patient, to read the reports, we'll now treat the patient, put the cups, and do everything for various ailments. We'll try and look at as many ailments as we possibly can within the time frame that we have. That too, we will have an end of unit quiz after it. And inshallah, for the next 6 months, these are basically what we'll be looking at. I'll send a copy of this clips to the group so everybody would have it. There could be some additions as we go through to make the course more full, to give more value, so to speak, to the course as we go through. Now, are there any questions before I move on? If anybody has any question, please, would be good to hear if anybody has a question. You can unmute your mic if you have a question, but if you don't have a question, I'll be going on. Okay, I'll take it that there are no questions, so I'll just continue from where we stopped. So this hadith that was narrated by Jabir ibn Abdullah relates that he had Rasulullah, that's the Prophet Muhammad sallallahu alaihi wasallam, saying, if there is any good in your treatments, it is in the blade of the Hijama. Hijama is the person who practices Hijama. It's a derivative from Arabic, from Hijama, Hajjam, and like that, Muhajjam. But the person who practices, that's the therapist, is called Hajjam. So if there's any good in anything you do to treat yourselves, in essence, it is in a drink of honey, branding by fire, cauterization, or the blade of the Hajjam, that's the hijab in Hijama, whichever suits the ailment. And I do not like to be cauterized. He doesn't like the fire treatment and co. But you see, this key thing here, the words here I want to draw your attention to is whichever suits the ailment, which means you should be able to diagnose, you should be able to understand the ailment and what type of treatment. It might not be limited to just these three, but whatever you want to do, there's a need for ilm and an understanding of what to do. So, like I said, Module 1, I will just go briefly over some parts of it, but we'll take it fully during our next lecture. The idea today was to get to see everybody, and I don't know, I'm sure after everybody gets the tape, we might get the next class might be more full, inshallah. And we will be having 3 lectures every week: Mondays, Tuesdays, and Thursdays. Mondays, Tuesdays, and Thursdays. These details will be given in the group. Same time, 4:15, would run for 30 minutes to 45 minutes, or as the case may be. And we will also have, on a day agreed by everybody in the class, inshallah, majority would carry the vote, inshallah. We will have a kind of a discussion class where it would just be to discuss what has been said, like a question and answer session, and to help before each quiz, so that we would be able to clear everything that needs to be cleared, and we are all on the same page as we go through. So, what is Hijama or cupping therapy? There are so many definitions to it. Cupping or Hijama therapy, it's a therapy which a cup is applied to the skin surface to cause local congestion through negative pressure, and blood is drawn from the locations where the cups are placed. course, the cups could be anything, as you can see there. Your teacup, your any cup would do basically, but there are special cups that are designed for this with special edges so that you don't injure the skin or rupture the skin. And technology has brought so many things into it now and co. And one of the reasons why you need to have all this knowledge to practice hijama properly is, like they say, half a doctor is a danger. Half a doctor is a danger to your life, and half a scholar is a danger to your faith. We all know that they say a little knowledge is dangerous, you know. So, and hijama in itself is a medical procedure, and it should be performed by people who know what they're doing and how they're doing it, and they know what they're doing, they understand the process, they understand the who, the what, the why, and the when, and all the bits and pieces about it. It's not just because it's a sunnah like a lot of people feel. So they just wake up in the morning, buy a kit, and go around cutting people and putting cups all over them, with a lot of complications that come up from it. So it is, it's just something that one needs to learn, inshallah, and like that. So, just a moment, one moment. You need to touch something here. Thank you. Sorry about that. Need to reduce some noise coming into the room. So, the word cup in itself was derived from the Arabic verb hajama and jama, which basically means to minimize or to restore, to reduce, diminish a volume, or bring something back to its original states. So you could say a person diminished the problem in Arabic, and they meant to return the problem to the original or back to where it was, or he solved the issue. So to withdraw, to a retreat. So where blood is drawn from the body, which is more or less wet cupping or hijama as it is, then it's called hijama, and it's dry sometimes when blood is drawn, but that comes to wet and dry cupping, which we will come into later as we go on. But basically, hijama is a process where a cup is put on the body, negative pressure is applied, and inshallah, we will go more into this. So tomorrow we'll be seen on Thursday, Bismillah Ta'ala, at 4:15. If there's any question, please put it in the group. I thank you all for attending, and may Allah make it easy for us as we go through this. Thank you very much for attending. Wassalatu wassalamu ala sayyidina Muhammadin wa ala alihi wa sahbihi wa sallam tasliman kathiran. Thank you very much. So see you on Thursday, 4:15 p.m.